Hi, welcome to another video of comments on psych meds by a psychiatrist. I'm Dr. Ankur Saraya, for those of you who don't know, and I'm a psychiatrist in private practice, and I'm just sharing some observations about medications that I've gathered over the course of my career. So today I'm going to be talking about lamotragine, brand name Lamictal. And right off the bat, this brings up a little bit of a controversy in terms of categorizing psychiatric medications. What I mean by that is, excuse me, just like antidepressants are sometimes unfortunately named because they're also very good for anxiety, and that's most but not all antidepressants, as I've referenced in a previous video. Also, for medications used to treat bipolar disorder, they can be referred to as mood stabilizers, but the reason that I say that it's a bit controversial with lamotragine is that, for me, a mood stabilizer is a medication that helps prevent or treat mania, so the manic symptoms of bipolar disorder. But individuals with bipolar disorder also have depressive episodes, and the symptoms of depressive episodes for bipolar patients look exactly the same as unipolar depressive symptoms. So the issue is that you can't use the same medications that you use for somebody with unipolar depression in somebody with bipolar disorder, because those medications have a tendency to destabilize that patient because they can trigger manic episodes and lead to fluctuations in mood that are destabilizing and not generally helpful. So, but what's useful and a very great thing about Lamictal is that, or lamotragine, is that it is an antidepressant used to treat the depressive symptoms in bipolar disorder, which will generally not destabilize the patient. Now, there have been reports of patients who don't tolerate it, but that's going to be true of just about every medication. But for the most part, lamotragine is not going to trigger manic symptoms and will treat depression in patients with bipolar disorder. To make things even more complicated, and this is where my anecdotal experience, I think, is going away from the hard data. And when I started out prescribing lamotragine, I reserved it for treating depression in patients with bipolar disorder. But something that I've started to hear about and have seen in my practice is that we sometimes think about using lamotragine in patients who have not responded to other treatments for depression, who may not necessarily carry a diagnosis of bipolar disorder, and also for patients who have residual anxiety that doesn't seem to respond to other treatments, but also may not necessarily carry a diagnosis of bipolar disorder. So what do I think is going on here? Do these people secretly have bipolar disorder? I mean, I think it's a version of that, and I think it's important to remember that we as human beings, we don't fit neatly into these categories. So you will have patients who have classic symptoms of bipolar disorder, but then you'll have other patients where they don't necessarily exhibit the symptoms that we usually associate with bipolar disorder, but they will have an underlying physiologic tendency toward, well, at least put it this way, they have a tendency to respond to lamotragine even though they're not exhibiting all of the classic signs of bipolar depression. So that's what lamotragine is mainly used for. It's mainly used to treat depression in individuals with bipolar disorder. But as I said, we sometimes use it for patients who don't clearly fall into a particular category and have symptoms of depression or anxiety that are not responding to the usual treatments. Now, the other important thing about lamotragine is that it has a very special dosing strategy because of a very specific and potentially severe side effect. So the dosing strategy is that you have to dose it very gradually. You start at a very low dose and dose it on a very regimented pattern or schedule where you go up on it every 2 weeks. And the reason you do that is to avoid triggering what is the consider the serious side effect with lamotrigine, which is a potentially serious skin rash, something called Stevens-Johnson syndrome, which is very serious, and we definitely want to be monitoring for any kind of new rash when starting a patient on lamotrigine. I will generally tell patients don't use any new lotions or soaps or anything new on your skin, because we don't want a false alarm rash. We don't want a rash at all, but we don't want to lose the opportunity to use lamotrigine because we've had some other rash come at the same time. But the good news is that since we've started dosing lamotrigine in this way, we really don't see the rash. It tends to be very, very uncommon. I've never had a patient develop it. I've never heard of anybody developing it. I've had patients stop lamotrigine as a precaution when they've developed a questionable rash, but nobody who's progressed on to the serious rash that we're concerned about. The other thing that this brings up is that if for some reason you have an interruption in taking lamotrigine, if you've been on it for a while, but you have an interruption for whatever reason that lasts more than 3 days, you have to start all over again from the beginning, because you don't want to go right back to the full dose, because again, the thought is that if you go from not having lamotrigine in your system back to a high dose, you could trigger the skin rash, and we definitely want to avoid that. So absolutely, positively, you need to you have to be aware, and I need to remind my patients periodically who are on lamotrigine that if they stop for whatever reason for more than 3 days, we've got to start all over again. I emphasize the serious side effect. The other piece of good news is that lamotrigine is otherwise generally well tolerated. I don't see a lot of other common side effects on it. When you get into the higher dose ranges, over 300 milligrams, I would say that some patients get a bit irritable at those higher doses. I usually end up landing around the 200 milligram range, and I find that that's usually where the sweet spot is, and where I maintain the majority of my patients, if not lower, in the 100 to 200 milligram range. So that's some comments about lamotrigine. If you have any other questions or other experiences, please feel free to comment. Thank you so much.